Hi, I'm Dr. Hoese with Prevent Physical Therapy here in Santa Rosa, California. Today I'm here to talk to you about the ACL. I'm going to show you a quick screen you could do for yourself to see if you have increased risk of an ACL injury, and maybe talk about some of the risk factors that might be associated causing that. So the ACL is the main ligament in the knee that helps hold the knee together, and if we get our knee in a bad position, specifically where it turns inward, the ACL gets pulled, and if it's too much force, it could break and pop. And if that happens, you're looking at surgery and 9 months to a year back to sport. So it's something we really want to get ahead of, and something that we focus here on at Prevent Physical Therapy. So the simple screen is just this. Just stand on one leg and go into a squat. Now, where does your knee track as you do that? If you go down to that squat and your knee is wobbling in and out as you go there, that's a sign that there's instability there, and that's going to create increased stress on the ACL. So another thing we could do if we want to look at more force, if this looks stable, you get down into that single leg squat, you get really low and back up, and that knee stays stable and in line with your toes, we can look at what happens when there's more force. So we can just step up onto a chair and just jump out and land on one leg. And what happens? If that knee is excessively wobbly in there, that again is a problem. So a simple thing you can do is just set your iPhone in front of you, put it on slow motion and jump, and then take a look at it afterwards. Does your knee track with the toes, or does it turn in or go out excessively? Now, certain risk factors that may be causing that would be, or could be, you can look at your foot mechanics. Now, if you have a flat foot and your arch is not supporting, that flat foot turns in as you land and the knee will then follow it. Another thing that we can look at is hip and core stability. So if we're not strong and stable through the core, as we land down, we may shift our shoulders right or left, pelvis drops out, and this unscrews the knee and it ends up turning it inward. That's a problem as well. Other things you might see is just strictly ankle mobility. If I can't bend my ankle and absorb the impact of jumping down, that force is going to have to go somewhere. And oftentimes, as the ankle stops, it drives the arch down, and then the knee follows. These are just a couple of examples of things that we look at that increase your risk for an ACL injury at Prevent PT. Others might be, it's just a pattern that you're just not aware of, and we just need to train out of it. Or your strength and stability, or your power control and development is not able to control that. So looking at bounding and jumping, we like to look at asymmetries right and left, and to see if that might be contributing as well. So here at Prevent PT, we get under the hood, we look at all these risk factors, and then we empower you to address them, so you're actually decreasing your risk in your sport. So again, Dr. Hoese, Prevent Physical Therapy, we're here to help. You can reach out to preventpt.com and learn more about our business, and reach out if you have any specific questions. Thank you very much.